it's essentially, as you say, the red tape has been slashed to allow recently retired doctors to have the ability to optionally opt in to assist with the efforts in dealing with the meeting the workforce demands of COVID-19 as it gets closer and closer to its peak. Of course, it's got to be in a systematised way. It's got to be with all the resources of ensuring that up-to-date training and capacity and support, not with the appropriate protective equipment and understanding of the proper infection control measures, for example. All of those items and all of those issues have got to be fundamentally addressed before they're able to be part of the response. It's about using them in an appropriate way also, clearly utilising the skills that they have already and slotting them into various parts of the health workforce. It's about coordination and systematic approach, but understanding that this is a temporary time-limited opportunity. It's about getting them getting additional supplies to a very, very potentially thin and strained workforce, robust capacity at this time.
Federal Labor is arguing today that fully qualified nurses in Australia on working holiday visas should also be allowed to work in hospitals during the crisis. Is that a push the AMA is backing?
We'll look at all those options in terms of support. Now, obviously, the nurses that's a particular other area of expertise in terms of the qualifications and registrations regarding that. But clearly, any appropriately trained health workforce professional has a potential to assist with the frontline response, as long as it's done in a properly systematised and supported way, ensuring that training and all those other standards that we would expect are able to be assisted with as the underlying process in that approach. It's not about throwing people into the deep end. That's certainly not what we would like to see, but it's assisted and supported process to allow them to work in a way that they can feel like they're doing their bit to also help out at a very, very difficult and very, very significantly important time, but also in a way that protects them and protects the public and the community that are going to be relying on that workforce.
It is early days, but what is your assessment of Australia's handling of this pandemic so far? Are you convinced that we are achieving a flattening of the curve, or could it be that with the testing guidelines just being relaxed now around the country, we are likely to see more evidence of community transition and potentially a big spike in confirmed cases?
So let me just make 2 quick points, please, Ashley. First of all, when it comes to testing, per capita, we've got I think the highest rate of testing per capita in the world now. 200 well in excess of 250,000 tests now have been performed, and with a positivity rate of around 1% or just under, it suggests that we're getting an appropriate idea of the people who are potentially at risk of being diagnosed as COVID-19. Now, with respect to the first part of your question, look, right from the outset, there's been a plan and there's been a process. Now, people might argue that certain parts of that plan have not been implemented as quickly as maybe other parts of the world. But if we look at that curve, if we look at the trajectory where it's at and understand that the bulk of those numbers still represent returning Australians back to Australia from overseas and the large import of those number of cases, we understand that we're still in comparison with that the first episodes with around the world, we're still doing rather well in comparison. But of course, that's not a reason to forget about what we're doing. Clearly, the stage 3 of the measures that have been recently implemented and the previous measures as far back as announced as now almost more than a fortnight ago now, just over, has starting to show some early signs, but it's a long winter. And we know that it's really a case of watching those community transmission numbers where there is no obvious contact, there is no obvious overseas source for that infection. We've got to watch those numbers, and we've also got to watch the fact that we're blessed. We've been in Australia. As Australia, we're an island continent, and there's only two ways in for the virus. Boat or plane, and so we've got the opportunity to monitor those. We've put those measures in place in terms of quarantining of returning Australians back to Australia for 2 weeks. So we've got that side of the equation, pretty well under control. We've had this process of identification, isolation, containment, and contact tracing. So that first phase, or that first part of the plan, has been working reasonably well to the date, and we've been able to really keep a lid on the number of community transmissions to really essentially pockets of Sydney and pockets of Melbourne. And even then, it's been because people haven't been following the advice and not taking the significant advice of authorities. So we've got to all, as a community, do the right thing by each other, if not for ourselves, but for our loved ones and all the other members of the community. It's about knowing that we're going to be in this for a very long time, at least throughout the upcoming winter months, throughout the influenza season, which we know is June, July, August, September in particular. And we've got to really be prepared to continue those early gains by doing the right things.
Has the government shared with you its modelling, looking at various scenarios of how the pandemic is likely to play out in Australia? And do you think it would help if that modelling was released publicly to help Australians understand some of the harsher policy decisions being made about isolation requirements?
Look, I haven't seen any modelling directly from the government. Of course, there are many people have postulated different models, and I know that there's a number in existence. But the important thing to understand is two things. Firstly, the information about the virus is changing every day. And a lot of the models are only as good as the information you plug into it. Now, if you plug in overseas data because of the numbers of where we're at, that's not taking into account the large number of returned travellers who are contributing to the caseload of COVID-19. So the models are only as good as the data that you're utilising. I think it's important, however, having said that there is a better information and sharing of the plan, both with all parts of the community. In particular, the health sector, and so that they understand what's required and where we're going, but also with the Australian public in general, because we're asking them to undertake fairly severe measures without an obvious enemy in sight. We see what the enemy can do overseas in terms of our TV screens and newspapers, but we can't see it directly at this stage other than some graphics about case numbers reporting, and so there isn't a direct impact. And if we need to tighten those measures up, or if we need to ensure that those measures remain in place for many, many months to come, especially in light of the severe economic circumstances that we're imposing on the community as a result of those measures, we need to have the community needs to be engaged in that understanding of the importance and the imperative of why we're doing what we're doing.
We're seeing standoffs with cruise ships off the New South Wales and WA coast. What is our responsibility to people on board? How concerned are you that if these ships do linger, the passengers may flood our health system? Do we have the capacity for these hundreds, perhaps thousands of extra patients coming in?
Let me reassure you that as we currently sit here today, our health system is in an extreme state of readiness for any uptick in whatever number of cases we might see. So it's about ensuring that whatever happens, it's appropriately managed and contained. So in that process. Now, clearly, this is many forces and many factors are in play regarding the cruise ships and what will happen there. But whatever, there needs to be, if they're in our waters and there is a level of medical need, that needs to be assisted with primarily. Now, I'll leave that to the authorities to work out exactly how that measure of response requires. But it's not a case that they will overload our system automatically at this stage, but it's about ensuring that we appropriately deal with the risk to the community in terms of any further progression in case numbers. So as long as they are on board the cruise ships, they're essentially contained there. We need to supply them with the appropriate medical care if they require it on the cruise ships. They're not at this stage looking to what needs to be done in terms of simply unloading them onto Australia without the appropriate resources and understanding of how that would be affected. So that's a conversation that's a complex one and one that several authorities need to be part of.
Dr. Tony Bartone, the President of the Australian Medical Association, appreciate you joining with your insights on Newsday this afternoon. Thank you.